going to start with clavicle. So I have the image receptors already in there. It's 12 side by side, 10 top to bottom. Make sure you have the little shelf in there at the right setting. I'm gonna go ahead and open this so that it's 10 top to bottom, 12 side to side, we're good. And then I'm going to center mid clavicle. So I'm gonna push around on my patient's shoulder here, find her clavicle. I'm gonna bring my light field up, and then I'm gonna line this up. And then I'm gonna have my patient take a little bit of a step to the left for me, because we want the medial portion of the light field here at the jugular notch, okay? So that makes sure that we're getting half of the sternum and then all the way out to the outside of the shoulder. So if you will leave it open side to side, the 12, that's fine. But then top to bottom, we'll close it down so that we're just seeing right above the shoulder and we're seeing all of that clavicle, okay? I need a marker. So, man, all these that I retaped are already not so sticky. Hold on. Around that one. Okay. So I'm gonna stick my right marker here in the light field. Make sure, again, it's not in the shadow, but it's in the light. And then we can use our rolling shield for all of these. So you'll roll that in front of your patient, okay? So this is just our regular AP clavicle. Find the clavicle, center mid clavicle. So that means between the jugular notch and the outside of the shoulder, and then collimate top to bottom, okay? The second view for clavicle is going to be a 15 to 30 degree angle. So the first thing I want you to do is bring your tube down so that when you angle up, we're not blinding our patient, okay? So I brought my tube down, and then for practicum purposes, we can use a 20 degree angle. So each of the little lines are worth 5 degrees, okay? You're gonna have to give it a tap because it doesn't like to kind of get stuck, okay? So I'm at 20 degrees there. I'm gonna come down and I'm gonna recenter on her clavicle, okay? And then you have to make sure you line your bucky back up, all right? So I'll bring this up here. Because of that angle, you have to come up quite a bit, okay? Now, I want you to note something. If you look at that red line, it is not in line with the black line, right? But when I have this pulled out, I am lined up to the middle of my image receptor. Because of that angle, we have that extra 2 inches that goes behind the actual front of the bucky, and so you will end up being aligned a little bit different. Okay, if you want to. So see how on here, not lined up on the front of the bucky, but there I'm lined up to my image receptor, okay? Makes sense? So the steeper your angle, the more of a variation you're going to have. So make sure you're lined up to your image receptor, not the bucky. Now granted, since we're collimating top to bottom, if we were aligned to the bucky, it would still be caught on the image receptor because we're not utilizing the entirety of it, but it's best practice to try to be perfectly lined up to your IR. Make sense? Okay, so put your back against the board for me again. And looks like you're in the same spot. So again, I'm centered on her clavicle, and my middle of my light field is here at the jugular notch, and I'm seeing light on the outside of her shoulder, okay? My right marker is in the light field. Roll your shield in front of your patient, and that is your AP axial clavicle. Okay, so for clavicle, AP with no angle, AP axial for practicum, do it about 20 degrees, okay? For the clavicle, your patient's just gonna hold their breath. So no fancy breathing instructions, but hold their breath so we don't have motion, okay? Moving on to the scapula. We have 2 views for the scapula. That's going to be your AP scapula and your lateral scapula. The lateral scapula position is the same position as the scapular Y for the shoulder. The only difference is our arm moves to a different area, okay? So again, we have to change to lengthwise. So I moved my little shelf down to the 12 line. I'm gonna lock that in there. And then I'm gonna change this to be 10 side to side and 12 top to bottom, okay? So I don't bring this quite that tall. Bring this down. And my IR down, perfect. All right, so the centering for an AP scapula, my patient's gonna put her back against the board. And then we are centering 2 inches below the coracoid. So the coracoid's what we found for the shoulder, right? And then we go 1 inch down. Now we're gonna go 2 inches down from coracoid and 2 inches in from the rib margin. So, I'll poke on here. Right about there. So I'm gonna go 2 inches down from there. Okay. And then 2 inches in from the rib margin. So come a little bit to the left. Or to the right, yeah, there you go. Perfect. All right, now I'm centered good. I'm gonna have my patient bring her arm up over her head. You can put like the back of your hand on your forehead, or the hand can go on top of the head, it doesn't really matter. What this is doing is bringing our scapula out from under the ribs to the outer border so that it's not as superimposed by everything, okay? When she's in this position, we wanna center before we have her bring her arm up, first of all, okay? And then we can put our marker down here in the bottom of this light field here. Now, my breathing instruction here is going to be slow, deep breathing. You can have your patient breathe in through a straw, is sometimes helpful. And then it's gonna be a 3-second exposure so that the ribs and lung markings can blur off of the scapula, okay? So make sure it's a slow, controlled breath though, so that her shoulder's not moving, all right? So go ahead and take a slow, deep breath in through a straw, and then beep, and that's our X-ray for an AP, okay? So think about it as the scapula, you can rock, because the scapula is on your back, you have all of this in front. The point is to blur the things out from in front of the scapula. That's why in this picture we do that breathing, okay? That's the only different breathing instruction for this practicum. So everything else is hold your breath, but for the AP scapula, it's gonna be that slow, deep breath, okay? Lateral scapula, I'm going to show you on her left because that's what's going to be easiest for you guys to see, but make sure on practicum you do the same side as you drew, okay? So on the right, it's gonna be the side that's over here, okay? Because when she goes to PA, it switches, right? All right, so go ahead and put your left arm across to your other shoulder for me. So left hand to your right shoulder, and then turn around, okay? Take a little step to the right for me. All right, and then turn your body about halfway. So we know our rotation for scapular Y is 45 to 60 degrees. It's that same amount of rotation. It's gonna be the same trick. We're gonna put the palm of our hand against that shoulder blade. So we're gonna find the vertebral border here, the medial border. I'm gonna put my hand on so you can step that direction for me. Perfect, a little more. And then step all the way this way so you're against the door. Move your feet so you're not leaning. There you go. And then hold on forward a little bit more. Okay, so we want our centering to be on that lateral border, or that vertebral border. So my hand is here on the blade of her scapula, my fingers are pointed straight at the image receptor. I am gonna come a little bit higher because we wanna be centered between the top and the inferior angle. So I'm gonna center right there. Actually, I'm gonna move you, here more, right there. I'm gonna bring this up a little bit, and then I'm going to collimate side to side. So I'm gonna close side to side. I am gonna leave it open top to bottom, and then obviously for this one it would be a left marker, but remember, if you start with the right, finish with the right, okay? This is just because this is easier for you guys to see. So, hand on the back, pointed straight at the image receptor, centered here, and then she's holding her breath, okay? Hold your breath. So, that is the 2 views for the scapula. With scapula, just remember that the arm is doing something weird, okay? You can relax right now. So for the AP, arm's coming up here. For the lateral, arm is coming across here. Because when we're doing the scapular Y for the shoulder, and we keep the arm down, we're looking for dislocation. Okay, so we're focusing at the upper Y portion of the scapula in that view. So we wanna see that humeral head, and we're looking to see if it's anteriorly or posteriorly dislocated, all right? Then when we do a lateral scapula and the arm comes up, we're not necessarily looking here. Now we're looking at the blade of the scapula to look for fracture. We're looking for anterior or posterior fracture of the blade of the scapula. This is super common in like motorcycle accidents, things like that. But we're not going to see the joint space well when that arm comes up and over, because now we're distorting the way that humeral head's sitting. So that's why for the shoulder we keep it down, but for the scapula we bring it up so that we can see this without the humerus in the middle of it. Make sense? All right, questions, comments, concerns? Okay, thank you.